Hi, everyone. Welcome to Tuesday Tips. This is Pam Dunwald. I am one of your nurses from Your Nurse Advocate Consulting, and I am a registered nurse and a board certified patient advocate. And I'm so glad you're joining me today. So, every week on Tuesdays, we're here to help families just like yours navigate the healthcare system, reduce stress, and really try and empower you to make confident decisions for your loved ones. If you're new here, don't forget to follow us and check out our free resources after the show. So let's go ahead and jump in. So today's topic is one that affects everyone. It's whether it's today, tomorrow, or 10 years from now, whether you're already retired, planning for retirement, or supporting a loved one that is retiring. You know, what is your healthcare strategy for retirement? And that's what our topic is for this week's Tuesday Tips. So, did you know that healthcare is often the biggest expense people underestimate in retirement? And yet, so many families don't have a plan until a crisis hit. And that's what when we want to help you avoid. For example, assisted livings can cost anywhere from to $8,000 a month. Nursing homes can cost between $6 and $10,000 a month, depending on where you live and what kind of care you need. Memory care is more expensive. Even independent apartments, because they do give you some assistance. Some independent apartments will have a dog walking service. They have in-house therapy. They have a doctor group that comes to see you. Even though you're an independent apartment, that could still run you $3,000 to $4,000 a month for an independent apartment, because they do offer some community meals and there's other perks as well, even though you're living independently in your own apartment. So let's start with a quick story. I recently spoke with a family, let's call them the Johnsons, who thought they were all set for retirement. They planned for travel, they planned for hobbies, they even planned for a new puppy. But when Mrs. Johnson had an unexpected hospital stay, they realized that they didn't know what their insurance covered, who to call for help, or how to get the care that she needed at home. And this is so common. I can't stress to you how common this is that, you know, planning for retirement and planning for old age and changes in healthcare conditions. I mean, that's not something that this is we're going to talk about this Sunday dinner when all the family's around. It just doesn't happen. Nobody wants to talk about those kind of things, although it's really necessary. So that's why having a healthcare strategy for retirement, it's just as important as your financial plan. Where are you going to get your money for retirement is important question, but also, how are you going to fund your healthcare needs? Sometimes you don't know that 5 years down the road, you're going to get a chronic health condition and something that you're going to have maybe be on expensive medications. Maybe it's going to need frequent doctor visits or even frequent hospitalizations. So you never know. And one of the things that we can do as your nurse advocate is that we can help you depending on what your healthcare challenges are currently, by what medications you're taking. We can really get a kind of good idea about down the road. So that's something that we can help you plan for as well. So what is a healthcare strategy? So what do we mean by that term, healthcare strategy? It really simply is a plan for how you'll manage your health and healthcare needs as you age before you actually need it. It covers things like understanding your insurance and coverage, whether or not you should consider long-term care insurance, choosing the right doctors in the care team, knowing, what doctors are covered under your insurance policy, know what you're going to do. Are you going to go straight Medicare with a supplement? Are you going to go to a Medicare Advantage plan? What are your needs, and what is the best type of coverage for you? And then planning for long-term needs. Is your goal to age in place, or are you open to going to assisted living or a nursing home? Because two different strategies to consider. And a lot of people don't realize that actually aging in place, if you have a lot of healthcare needs and need a lot of care in the home, that actually can be more expensive than going to an assisted living. So we really need to look at your situation, and everyone is different. But don't worry. We're gonna. One of the other things that you need to plan for is to build your support network. Friends, family, professionals. Maybe you're part of a church community, and do they have a group that helps people, shut-ins that belong to their church. So these are all kinds of things to think of. And we've got lots of resources. What I can tell is all these things we talked about, we have free resources, free guides, checklists. Go to our website, yournurseadvocateconsulting.com, and you can hit the free resource tab, and you'll see all kinds of free resources for all of these topics that we're talking about during this Tuesday Tips. And don't worry, we're gonna break all these things down together. So component number 1, understanding your insurance. So first, let's talk about that. Do you know what Medicare covers and what it doesn't? Do you know, and this is something that I also learned recently, is that if you're on Medicare or I'm sorry, if you're on a Medicare Advantage plan, which is insurance manages your Medicare dollars, and it's treated like insurance, but they do have to follow the Medicare guidelines. But if you're on a Medicare Advantage plan and you come up with a chronic condition, a health condition, you may not be able to switch to a Medicare and then a supplement. A Medicare and then a Medicare supplement is the best coverage you can have. It's the most expensive, but it's the most comprehensive, and you're going to pay the least out of pocket. And so when you've been on an Advantage plan for so long, and now all of a sudden you're going to be spending a lot of time in the hospital and you'd like to get more coverage, oftentimes insurance companies, you can't switch to a Medicare slash supplement plan if you have that chronic disease. So these are all kinds of things that you want to talk to a healthcare professional, a Medicare advisor. You want to make sure that you know what is going to be right for you. And then we talked briefly about long-term care insurance. Long-term care insurance can be expensive, but one of the nice things that long-term care insurance covers is caregivers that are coming into your home. So if your goal is really to age in place and you don't want to consider assisted living or a nursing home, then you may want to look into a long-term care insurance. And looking at long-term care insurance, I don't care if you're in your 20s, it's going to be a lot less expensive when you're young than when you try and get it at retirement age. It's going to be very expensive. So many people are really surprised about to learn about things like home care, certified home health care that's covered by Medicare, assisted living, or even some medical equipment often aren't covered by Medicare. That's why it's so important to review your coverage each year and fill in gaps. So non-medical home care, which is considered custodial care, like assisting with bathing, meal prep, laundry, running errands for you, that is not covered at all, zero by Medicare. The only home care that Medicare covers is when you have a skilled need for a nurse or a physical therapist, or a occupational therapy. So basically nursing or therapy. If you have a need for a skilled medical professional, then Medicare will cover that. And they are short term. They're only in for a few weeks. They come maybe 2-3 times a week, and it's very intermittent. They're not going to be there every day. So that's why it's really important to, review your coverage, know what your plan covers, and what gaps are you thinking that you may need to fill. So if you have questions about Medicare insurance, drop them in the comments or send us a message. We're here to help. We have videos. Go to our YouTube channel. And on our YouTube channel, we have lots of videos. Just go in the search bar and look and just put in the term Medicare. You'll see videos. We have videos at length that goes into this exact topic that we're talking about. So component number 2 is choosing your healthcare team. So let's talk about what we need to consider here. Do you have a primary care provider that you can trust? I mean, are you moved to a new area? Do not know where to go? Have you had a doctor for a long time? Now you've changed insurance companies and now your doctor's not covered. A lot of these things can occur. And, a lot of people don't understand. You can make a consultation appointment with a provider and you can go. I mean, it is an office visit, but you can go and sit and chat with them for X amount of minutes. Every clinic is different. And just see if you're a good fit before you take them on as a primary care provider. I mean, a lot of people don't understand or realize that you can do that. And that really is a thing. So, You know, have you talked to your family about your wishes? This comes up a lot when we work with siblings, managing the care of their aging loved ones. It's really hard on your family when an aging adult does not have their affairs in order. And again, our blog posts, YouTube channel has tons of information on what that entails and what you need to do. But if you have your wishes documented and you have all the power of attorneys and things like that in place, that takes so much stress off of your family, because they now don't need to argue over what they think is best for you. All they have to do is agree to follow your wishes. And so that makes it a lot easier and a lot less opportunity for conflict when you've said, even if they don't agree with your wishes are, they can agree that those are your wishes and that they will follow them. So it's also a great idea to build relationship with specialist pharmacists. There's social workers at your clinic. And of course, consider having a nurse advocate in your corner. We help you navigate the system. We know what the right questions are to ask, and just make sure that you're getting the care that you deserve. And that's what's really important to us. And the nice thing about us is we're independent. So we don't work for a hospital. We don't work for a clinic. We don't work for an insurance company. We only work for you and your family. So that makes our loyalty, to you, and we don't have to answer to anyone else. So it gives us a great opportunity to be able to advocate just for you and what your wishes are. So who's on your healthcare team right now? Tag them or give them a shout out and say, hey, I really appreciate you, because the caregivers it's truly a labor of love. I swear, being a caregiver is the hardest job in healthcare. And when I was going to nursing school, 40 some years ago, they started in where you had to become a CNA. You had to become an aide before you could enroll into nursing school. I am so glad for that, because I really had a great appreciation for the CNAs, for the certified nursing assistants at the hospitals, because that is a hard job. And so I was always willing to help them and lend a hand, because that is a tough job. So let's move on to component number 3. So planning for long-term care versus aging in place. Here's the reality, and it's kind of staggering. So about 70% of the people over the age of 65 are going to need some form of long-term care. And this could mean help at home, assisted living, skilled nursing. Long-term care can be expensive, and it's not always covered by insurance. And this is another misnomer. This is something that people don't understand. So like if you go to the hospital and you have, say you fractured, you broke a hip and you need rehab, or you had some kind of surgery or pneumonia and you were really debilitated in the hospital for several days and you need to get strong again before you can go home. When you go to a nursing home for rehab, that is covered by Medicare. You've got 120 days to stay at the nursing home. The first 20 days are covered at 100% by Medicare. And then the other 100 days, you have a 20% copay. And after you've reached and used your 120 days, you are now on private pay, or you need to look at whether or not you would qualify for Medicaid for state assistance to continue to stay at the nursing home. So you can see how these dollars could add up very quickly. So have you thought about how you're going to pay for the rest of your retirement or living out your golden years? Are there local resources or programs you can access? I preach this, and I know I've said this so many times in different presentations. Every county in every state of the United States has a government agency on aging. They all have different names. If you're not sure what it's called, check with your clinic, call your local health department. They will tell you exactly the name and where your county aging office is located. They are the keeper of all the resources in your county, and that is a great place to start when you're looking for resources. So one of the other things is that we always recommend starting conversations early. And by starting conversations early, you don't have to have the whole blown out conversation conversation. That's very overwhelming. If you start the conversations early, then it gives you time to continue that conversation, and you don't need an answer right away when there's maybe a stressful healthcare crisis going on, and then everybody's on edge, and nobody's on their best behavior. Everybody's very emotional when things like that happen, especially if it's a serious illness or injury. and make an appointment with a financial advisor, make an appointment with an elder attorney or estate planning attorney. Meet with these professionals, meet with your nurse advocate or another healthcare advocate, and just see what you need for your specific situation to help plan for the future. One of the free resources we had that we mentioned by going to our website and just clicking the tab on the free resources is we've got an emergency to go folder checklist. It's a guide talking about why you should have a folder, and then it has a checklist for the contents that you can put in a folder. And I know there's medical binders, and the binders can be big and heavy. They're real important to have a complex history for you. It's great for when you travel, but you should have at least a plastic folder, so you can wipe off. They have those plastic folders that snap closed, just to have the things that you need for an emergency in case you have to go to the emergency room and you're not able to speak for yourself. Everyone will have what you need. And what a lot of people don't understand, especially if you're traveling or visiting a family member, not all the healthcare systems, the electronic medical records, talk to each other. They could be on the same system. Like, for example, in our area, we use Epic, but Epic Gunderson and Epic Mayo don't completely talk to each other. So it makes it very difficult. So even though you may think they're on the same system, they may not have access to everything that they need. So make sure you check out that free resource. So key component number 4, making your wishes known. Advanced care planning is one of the greatest gifts you can give your family. And I say that all the time. Do you have an advance directive? Do you have a living will? Who are you chosen as your healthcare power of attorney? Make sure you choose someone in that first position that is going to follow your wishes. Some people, like my in-laws, they just put it in birth order. My family, we kind of put it in order by what we were, people are good at and what their zone of genius is. So there's many ways of doing it, but just try and put some thought into who's going to be your financial planning attorney, who's going to be your executor of your will, who is going to be your healthcare power of attorney, because these people, when you are no longer able to make decisions, these are the people that are going to be, legally able to take over. So, it's not just about end of life. It's about making sure your values and your preferences are honored every step of the way of your aging years. So if you're not sure where to start, we've got templates and guides again so let us know in the comments or check out the website. Again, just go to the free resource tab and you can pick anything that you need, just search for the topic that you need to work on right now. So key component number 5, building your support network. Finally, don't try and do this alone. It's impossible. You will burn out so fast. And some people are of the mind that they don't like to ask for help. They carry everything on their shoulders and they say they can do it. And then they just have a breakdown. And so, I always tell people that asking for help is not a weakness. Asking for help is actually a strength to know that what your limits are, what you can do, what you're capable of, and at what point in time are you reaching your breaking point that you do need. So please don't think that asking for help is a weakness. It actually is a strength. So who will help you manage appointments, medications, emergencies? If you're gone on vacation, do you have a family, siblings? Are there out of town people that can help? There's lots of things that out of town family members can do. And again, lots of resources on that in the free resource tab. So at Your Nurse Advocate Consulting, we really believe that families deserve a team. And that's why we offer consulting. We have our membership programs and a supportive community to help you every step of the way. So let's recap and look at some action steps. All right. So number 1, review your insurance annually and look at whether or not long-term care insurance might be something that would benefit you. Number 2, building a trusted healthcare team. Who's going to be part of that team? What resources do you need? 3, planning for long-term care needs. Whether or not you're planning on aging in place, will you need to bring caregivers in the home? What kind of help we might need? Or are you willing to look at an independent apartment, assisted living, or possibly a nursing home? And a lot of people, with dementia, they stay home as long as possible. But then sometimes they do need memory care because sometimes it just doesn't get safe at home. So That's another thing to consider. So number 4, making your wishes known. Make sure your family knows what you want, what your healthcare wishes are. Make sure you choose your power of attorneys carefully. And then number 5 is create a strong support network. And again, this is part of what we can do. If you're looking at that, we can help you put a plan together, look at what's available in your area, whether or not you may need adult daycare, or whether you have neighbors or family members that we could build a team with, or a little bit of everything. So that's one of the things that we can help you with. So which of these 5 topics do you feel most confident about? And then which one of these do you really want to work on next? So share that in the comments. We'd love to hear what you're working on, and make sure that we have all the materials that we can provide to support you. So if you found today's tips helpful, please like, share, follow us for more. Subscribe to our YouTube channel. That's where we house all of our replays. We have some exciting new videos coming up. We're going to be talking to someone that runs a nursing home. We're going to have a tough conversation about going to a nursing home, what some of the challenges are, and why some nursing homes maybe get a bad rap, and what nursing homes are doing a good job and why. So we're gonna have that. We're also going to be working on a video coming up soon with a senior certified senior real estate agent, and what can they offer that's different to seniors when they're helping them move, or when they're helping them find a new house. Again, in that same note, we're working with a moving company, not just a real estate company, but a moving company who actually specializes in seniors. So I'm really excited that all of these companies and all of these things are coming to light that are helping our seniors, because again, in the year 2030, every single solitary baby boomer will be 65 years of age or older. So we know how big the baby boomer generation is. So that's going to be really important that we have enough resources to care for aging adults. So don't forget, download the free Emergency to Go folder. If you have questions or you think you need help, we always have, just book a consultation. We do a free 30-minute consultation. Whether or not you use our services, we will guarantee that we'll give you at least 2 or 3 action items that you can use right away to set you on the right path. One of the other things is to join our Your Nurse Advocate Now. We have 4 tiers of membership, from free all the way through paid, depending on how involved you want us to get. The pricing is extremely reasonable. Check that out. And thank you for joining me today, for Tuesday Tips. And again, I am Pam with Your Nurse Advocate Consulting, and we will see you again next week. Take care and have a good week.